Hi, my name is Michelle Ferguson, and thank you for joining us. We'll be talking to Beth Capobianco from VNA Community Healthcare. Beth coordinates the many flu clinics throughout the shoreline for the home care agency. She's going to be discussing the flu vaccine this year, the various clinics that VNA Community Healthcare will hold, and dispel any myths that you may have. And after last year's shortage, I know I'm curious, and I'm sure you are too, to find out what's in store this year. So Beth, let's start with the basics. What is the flu?
Well, the flu is a contagious respiratory illness that's caused by the influenza virus. It's enters your body through your respiratory tract, which is your eyes, your nose, and your mouth, and it eventually ends up in your bloodstream. It can be very serious. It can lead to hospitalization and in some cases even death.
And what are the symptoms?
The symptoms for the flu would be fever, cough, runny nose, stuffy nose, sneezing, just your body aches, and just an overall feeling of being very tired.
And is getting the flu shot our best defense?
Getting a flu shot is your first and best defense.
Okay. And what does the vaccine actually do?
What happens with the flu shot, it's an inactivated virus, meaning that the virus is killed. When it's introduced into your body's immune system builds antibodies towards the illness. And so if you get exposed to the influenza virus, your body already has the blueprints laid and knows how to fight it off so that it can help prevent you from getting sick.
Okay, so why do we have to get one every year?
You need to get a flu shot every year because the effects from the flu shot weaken during the year. And also, the different strains or the different variations of flu change from year to year. What happens is the CDC, or the Centers for Disease Control, they find the three most common flu viruses that are going to be expected for that year, and those are the viruses that they put into the vaccine.
And what are the strains that are in the vaccine this year?
Well, people will be glad to know that H1N1 is included in this year's strain. Also, the vaccine is containing H3N2, and it will contain influenza B that was in last year's vaccine.
So I know last year we had to get 2 vaccines. Is that the same this year, or is it
No,
different?
this year, because H1N1 is included, you will only need the 1 injection.
And last year was the terrible shortage. Or how are your supplies looking this year?
Supplies are looking very good. Last year's shortage was due to the emergence of the H1N1. They had to stop the production of the regular flu vaccine to get enough H1N1 to cover everybody.
So everyone could get a flu shot if they choose to this year. And really, should everybody get a flu shot?
Yes, the Centers for Disease Control is recommending universal vaccination. That means that they feel everybody should get vaccinated for the flu.
And now I know that you brought a slide pinpointing a specific population that's at high risk that should definitely get the flu shot. So do you want to talk a little bit about that now?
Sure. Pregnant women should get the pregnant women are high on the list. Young children, especially between 6 months and 2 years old. Children under 6 months aren't even eligible to get the vaccine. So anybody who takes care of small children should really make sure they get vaccinated. Adults over 50, people with chronic medical conditions, especially people with respiratory illness, those people that are living in skilled nursing facilities or long-term care facilities, health care and child care workers, and again, any caregiver taking care of anybody who is elderly or in the high-risk population.
Okay, so I saw that pregnant women are on that list, and I know some people are concerned to get the vaccine. Could you talk a little bit about what the VNA is doing?
Sure. VNA Community Healthcare takes special precautions for women who are pregnant or nursing, and we offer them preservative-free vaccine.
So is there anyone who should not get the vaccine?
Yes, anybody with fever, who is sick with fever, should not get the vaccine. If you have a little sniffle or if you have a small cold, you can go to the clinic and talk to the nurse about that. But if you do have a fever, it's best to wait until the fever's gone. Also, anybody who has egg allergies, is allergic to the preservative thimerosal, or anybody with Guillain-Barré, they should not get the vaccine unless they speak with their physician first.
Okay. Now you mentioned an egg allergy, and I know that the flu vaccine is actually made with hen eggs. And with the recent salmonella scare and recall, is there anything we should be concerned about this year?
No, there's no reason to be concerned. These drugs are highly regulated and they're screened. And besides, the eggs that are used to make the vaccines with are not the same eggs that we consume.
Now, there's something that I'm sure everybody's wondering, does it hurt?
Okay. Injections, like with any other shot, there's a small pinch when you get the injection, but there are a few tricks that you can do. A lot of times if you leave your arm limp to the side, when the nurse injects you, your muscle will be happier if it's looser. And remember, the nurses from VNA Community Healthcare, we give up to 200 injections at a time, and we get really good at it.
Well, that's good to know. Is there anything else that we could do to prepare for going to a flu clinic?
Definitely. It's very important when you come to the flu clinic that first you have all your insurance cards, and also that you identify what your primary insurance is. Once you finish filling out the forms and get that information settled, you'll go over to see a nurse. The injections are given up high in your arm, so they're not given down low. It's important to be able to access that upper arm. So if you want to wear long sleeves, make sure it's a sweater that you can take off. Also, don't be surprised if the nurse asks you if you're allergic to eggs or if you've had the flu shot before, because if you haven't, you'll need to wait.
And are there any other side effects? You said that people first time should wait to see if they have a reaction, but what about people that have had it before?
Well, the reason why we ask people to wait if they've not had the flu shot before is in case, like with any new medication, there's always a potential to have an allergy to it. So if you do have the flu shot for the first time, they are going to ask you to wait so that in case something does happen, the VNA nurses can help you with that. Also, if you get the flu shot, it's not uncommon for the day after or maybe for 2 days to have a little tenderness or redness at the site. Some people feel punk for 2 days, and that's because their body's busy making these antibodies and your immune system's working hard.
I've heard many people say, I'm not getting a flu shot because I've gotten the flu from the flu shot. Is that even possible or likely in any way?
No, you cannot get the flu from the flu shot. Like we talked about before, it's an inactive virus, it's killed, you can't get it. However, there is the possibility that you were exposed to the flu prior to getting your flu shot, and it does take 2 weeks to build immunity, so you also may come in contact with the virus during that 2-week time that you're still building immunity. Also, because they use the top 3 flu viruses, it's also possible that you came in contact with another flu virus. And also, people have flu-like symptoms, but it may not necessarily be the flu that they've come down with.
Could just be a really bad cold.
Could be a very bad cold, that's right.
Okay, so are there any benefits to going to a VNA Community Healthcare flu clinic versus a pharmacy or a box store? It seems like everywhere you turn there's a flu clinic or flu shots available.
Well, obviously, I feel that there's a great benefit coming to the visiting nurses. Remember, everybody who gives your shots is a licensed nurse. We give lots of shots, and like I said before, and we get very good at it. Also, VNA Community Healthcare is a community-based organization that is able to provide services for people in the community who otherwise may not be able to get them. So by supporting the visiting nurses, you're actually supporting your community. And also, you go there and you see your friends, and it kind of becomes a social event.
Yeah, I never thought of it that way, but that does make sense. Are there any other tips you can provide to help us stay healthy this winter?
Sure. First of all, again, like we've been talking about, it's very important for you to get your flu shot. Also, you need to take care of yourself. You need to do very good hand washing. That's very important. Avoid touching your eyes, your nose, and your mouth, because again, that's where the disease is transferred into your body from. Make sure that if you do cough or sneeze, you do it into your arm. You, again, wash your hands. Don't be one of these tissue stuffers that puts your tissues under your arms. Make sure you throw your tissues away. Don't go to work if you're feeling sick, because you're just going to make others sick. Avoid people who are sick, and just take good care of yourself.
So if we do all the right things and we do somehow manage to get the flu, what should we do?
Well, it's very important. The first thing you should do is see your physician. He's going to want to start you on antiviral medications. The antiviral medications aren't going to make it go away, but it can lessen your symptoms, and it can help prevent hospitalization. Also, you're going to want to keep well hydrated and treat your symptoms.
Okay, well, thank you, Beth. This has been very informative. For more information about VNA Community Healthcare's flu clinics, we have a slide up now that has our hotline number, our website, and also you can follow us on Twitter. Thank you.
Hi, my name is Beth Capabianco, and I'm one of the many nurses from VNA Community Healthcare, here to remind you that it's time to start thinking about getting your flu shot. VNA Community Healthcare will be offering many clinics throughout the shoreline area, so please call our flu hotline or visit our Fight the Seasonal Flu website for specific dates and locations near you. Thank you, and remember, the best way you can fight the flu is to get yourself immunized.